A simple x-ray saved my life. I was about 9 months old, and it was Christmas time. My parents put me to bed. My dad could hear me breathing. Lori, there's something wrong with her. We have to take her to a doctor. So they did. The next morning, they take me to the doctor. The doctor performs his test, checks me up, sees what's wrong. His diagnosis, allergies. Well, doc, is there anything we can do? No, she's too young. Well, all right. They took me home. They did their daily routine. The next few days, they could still hear me breathing. Lori, there is something wrong with her. We have to go to a different doctor. So within the next day or two, they went to a doctor. They went to a different doctor, and they told them, they updated the doctor on what the past doctor had said. Allergies. Doctor checked it out, so it did. Disagree with the first doctor. Oh, that's fine. Yeah, allergies. Well, my parents, being the people who they are, asked if they could see a specialist. So the next 2 weeks, they finally got into a specialist to check me up, and the specialist, the first thing he said was, well, did you do an x-ray? No. Well, that's the first thing I would have done. So take me to the x-ray room, and the x-ray technician does the x-ray, and he says, oh my gosh, looks up at the x-ray picture and sees this big circle in the middle of my throat. Turns out there was a battery in my throat from that Christmas time when my mom was arranging presents. So within the next 45 minutes, I was in the operating room, and the doctor, when they knocked me out, they said they have to put his foot on my neck to be able to, on my chest, to be able to rip that sucker out. Well, my point to this is that it's all about the diagnosis. The first doctor missed it, the second doctor missed it, and if that third doctor had not been thorough enough, I would not be here today. Hi, my name is Payton Schwantz. I'm a first-year IASM student, and I'm studying to be a physician assistant to orthopedic surgery. Throughout this course, I have done a few informational interviews where I interview the professionals in my field that I've chosen, and I have brought together the information with a few interviews that I've done. My first interview was with Chris Holmes. He is a total joint replacement PA. Since he was my first interview, he was very informative of the day-to-day basis of what it's like to be a PA, their daily routines, what they work with, the type of patients. Well, what I realized is the first question I should have asked him was, what is your specialty? Because that completely determines the roles and the patients that you have to deal with, either hospitalized or they could be going later that day home. Also, one of the other things that he really iterated was that his job is to make the surgeon's job easier by preparing him, being there for him, acting as third and fourth hands during surgery. So it's all about making his life easier. The next interview that I did was with Heather Gerke. She was a neck and spinal PA. One thing that she really said that stuck with me was that it's okay to do something out of your comfort zone, like something as neck and spinal. That's very intimidating. You don't want to mess anything up. There's a lot of liability in that. She said that when you're doing your PA rotations in school, that they educate you over absolutely everything, and that something of the more intimidating sort should not drive you away from that specialty. If anything, it should entice you and encourage you to do that. Since the liability lies more with the doctor, you should not be scared to do something of this sort. One thing she also involved, With the next interview that I did was with Jackie Ramsdale. She was actually the very first PA that I had met and the reason I became interested in the PA study. She taught me about the medical reps in the OR room and how they bring the supplies for the surgery, such as sutures, screws, and the plates that are nailed onto the bones of the patient. They would also bring the new tools and developments that they would bring, They would bring the new tools and developments that would be for the surgery. Another thing that she brought about was the different specialties for something along the sorts of terminal medicine versus orthopedics. Terminal medicine would be with working with older people. Most likely they would not recover and they would be going into a downfall after possible surgery. With orthopedics, you usually see more active people that are willing to get back into the system and ready to get back into their daily lives. So it's more rewarding in that sense. Also, due to the high demand for PAs, you're able to choose more of what you want instead of being forced to go into a certain specialty. My last interview that I did was actually with my new mentor, Laura McDonough. She was a PA for 30 years, so the wonderful thing about her is that since she is so experienced, she is able to basically run the practice almost as if she is a doctor. So she also mentioned that success in her job satisfaction also came from her working tendencies. So what you put in is what you get out. And she has done that for the past 30 years, and because of that, she is able to almost run the practice as if she was a doctor. She also told me the key to success was to pre-diagnose the patient before approaching her doctor about a case, so that she would train herself how to figure out the situation on her own and also make the doctor's job easier by doing that. It usually improves your relationship with him as well. After the interviews, we also did our own research assessments, and with that, most of the research assessments that I did were off of what I slightly learned in interviews that I was still confused about. So I went and dove off into my own little world of not knowing certain things, so I went and figured it out. I did my research on that. For examples, I didn't know the extent of sutures and stitches, so I researched that. I figured more about the rotations in PA school and reconstruction surgeries. With my original work, my mentor and I decided to do more of an informational pamphlet that informed patients of the best shoe to buy for their condition. So what that means is that I would gather the information I possibly could about certain conditions of the feet, such as plantar fasciitis or ulcers, diabetes, how that affects the foot, and in that sense, we would find the best shoe and the best type of modifications that you can have for that specific injury or condition. So from there, I did my research, I figured out about those conditions, I figured out the best type of shoe for that, and from there I created my own evaluation of the ultimate shoe for that condition. So in my research, or my original work, I have this little pamphlet that if you go through it, you'll be able to see the different conditions and the best shoes for it. The best thing about this is that not only did my mentor need it for her everyday use, as she is constantly asked, what is the best shoe that I can get? She thought it would be wonderful to be able to just hand an informational pamphlet to that patient that she gets to educate them herself, but she, over the years, has learned that patients only retain 10% of what the doctor tells them. So by giving them a pamphlet, they're able to take that information home and continue to research it and continue to look through it. Also, with this, it expanded my own knowledge, and I was able to gain a wider understanding of everything of the field. As she is able to benefit from the pamphlet for her patients, I was able to benefit from the knowledge that I gained through going through this research. Also with my mentor, I met her through the ISM community. Through a friend of a friend, I was able to find her, contact her, do an interview with her, and I found that she was the most well-versed of all the people that I interviewed. For the professionals, she's been working for 30 years, I mentioned that previously, and she had the most to offer in that sense. She has been very insightful with everything. The wonderful thing about her is that she has understood from years of experience that to find the best doctor is to find the doctor that's willing to train you and to teach you willingly, that doesn't feel reluctant or just hoping you know it already. So she has done that process onto me in trying to teach me everything that she possibly can. She's very willing to work with me, and she is very educational. She practically runs her own practice. As the doctor during surgical days, she stays in and works with the patients and is able to act as the doctor as he is away. Because of her years of experience, she is she is constantly capable of doing things on her own, and due to that, she is the best possible option for me as a mentor. The quote that I chose for this year of ISM is that if my mind can conceive it and my heart can believe it, then I can achieve it, by Muhammad Ali. And that is very prevalent in my life, is that I have found it has been very encouraging, it is very realistic, and it is true, because if you do set your heart to it and you have that work ethic, you can do it, and that is it for now. Thank you. Oh.